I'm Claudine Wong, joining you from the San Francisco Bay Area, and I'm joined by Anna Wexler, who is a professor of medical ethics and health policy at Penn. Thanks so much for joining us for this conversation.
Thank you.
Okay, so let's talk about this because I want to talk about this op-ed that you recently wrote for the Boston Globe. I'll really quickly just share the headline, and it says, "The trouble with calling healthcare workers heroes, when we call healthcare workers heroes, we're failing to acknowledge they're also human." A really interesting article, which had a really interesting perspective. And I'll stop sharing that for a second and let us kind of go into your background of medical ethics and health policy and kind of what led you, even both personally and professionally, to write this op-ed.
Sure. So, professionally in my research work, I study the ethics of emerging technology. So questions like how do we make policy, how do we make decisions when, a technology or a therapy is really very new and we don't know what the potential harms would be. So in my professional line of work, I think a lot about risk and how to manage risk and how to quantify risk, especially when there are unknowns. And part of
Which
what
is
led me to write, yeah,
complicated, right? I mean, it's not always an easy, we should do this. I mean, it brings up, with so many situations, a very complex situation in a normal world, in a non-COVID-19 world, in just regular space.
absolutely. And so actually most of what I do is try to gather data to somehow quantify risk, right? To reduce the unknowns, to reduce the potential, to really help inform decision making
Okay.
about the
And,
unknown.
and so personally, you're affected by this as well. Let's pull up this very beautiful family photo. So tell me about your personal life and how really kind of it all, worlds kind of crashed together in this space.
Yeah, so I'm married to an emergency room physician, and I have a 2-year-old son. And that photo was taken before I was pregnant with the second one. I'm currently in the second trimester of pregnancy with.
Congratulations.
Thank you.
Congratulations. So
With
you
another.
have little ones to worry about. You have your husband who is, essentially now on the front lines as well. Does that change how you look at things as well? I mean, certainly, when you talk about what conversations you guys are having, you know, at the dinner table, it is certainly about all of this kind of coming together.
Yeah, and it's about risk. I mean, so these same questions that I, study in a professional sense just came right into our home. So my husband, is at risk every day when he goes to work. He's at risk of catching COVID-19, catching the coronavirus, and bringing it home. And especially being pregnant, there's very little data out there on how this can affect pregnant women, how this can affect the health, of our unborn child. So not only is he at risk every day when he goes to work, but it's, we're thinking about the risk that he brings home to the family.
So tell me about those dinner table discussions in terms of, I mean, was there a point where you said, should you be going to work? Should you be coming home and sleeping in this house after you've spent a whole day at work, in terms of what he's seen and how nervous he is? I mean, I know some healthcare professionals who don't go home. They have stayed in whatever kind of housing they can. So in order so they can do their job and not bring it home to their families.
Yeah, I would say we've had those conversations constantly, really since day one. When we realized this was in the United States, we've had these conversations, and down to these nitty gritty things that you don't really hear about, like, should my husband enter through the garage, or should he come in the front door? When should he take off his shoes? Should he wash his shoes? Should he shower outside, or should he get undressed in the foyer? Just these nitty gritty questions of what can we do to prevent it from coming in. And we've made the decision to not have him self-isolate at this point. I think if the situation increases, if he's seeing a greater number of infections where he works, we might change that. And we've actually prepared the basement for him to self-isolate if that becomes.
Did it surprise you guys a little? I mean, because he's an emergency room physician, so he sees all sorts of stuff. It's not like, the people in our lives who are healthcare professionals don't often, they literally know how to manage that risk in a general way, because they're always bringing home something, or potentially bringing home something.
Yeah, and I mean it's second nature to him in some way, right? So I mean, he works in both pediatric emergency rooms and adult emergency rooms. He's constantly seeing the flu, for example, during flu season. So it's second nature to him to think about, let's say in the office, right? To think about how to wash his hands, he's constantly Purelling. But there's so much that's unknown about
Yeah.
this virus.
And
And
a lot of stress when
potentially,
you've got a little one as well and you're pregnant. And
yeah.
I mean, talk about having a lot on your plate. It's a lot. Do they have enough personal protective equipment? Do you feel comfortable that he's protected in the best way he can when he leaves the house and goes to work?
So, I have to answer that question very carefully because there's been a lot of retaliation against hospital workers who've complained or at least publicly mentioned that they don't have enough personal protective equipment. So I will say he actually works at multiple emergency rooms. So if I speak about his situation in specific, it's not clear which one he works for. But in the beginning, he did not have enough. And actually, we were reading the data about asymptomatic transmission, and he began wearing a surgical mask to see all patients. And he actually got in trouble from the hospital executives for overdoing it and for scaring patients. So
That
he
was
was
certainly
trying.
a lot in those first days of when people are saying, you know, is this too scary? I mean, I know even, grocery store workers who brought in their masks were told you're not supposed to wear that. You're freaking out the customers. And they were saying, well, what about me being freaked out about coming to work?
Yeah, and coming home to your families, right? So those grocery store workers, those healthcare workers, right? They may be at high risk themselves, or they may be living with someone who's, they may be living with a parent, with a child, someone who's at high risk. So, they're thinking about themselves, but they're also thinking about their families, I can assure you, every day.
Yeah, and I know we have seen certainly, the headlines. I see if I can pull up one of them of people suspended. This is what you're talking about. People suspended for refusing to treat coronavirus patients without N95 masks. And so, this is just one of, and we've seen this. This is not, a specific unique to kind of one specific place. It is something that we've seen across the country, which then leads us kind of back to this op-ed that you wrote, kind of addressing this issue. And tell me how, the journey to deciding this is something that I want to write about, and how am I going to share this thought process with people in a productive, I would say, way. Here's the headline as well, because the healthcare workers being called heroes, I think a lot of people are doing that in a show of gratitude.
Yeah. So I will say first off that I do think if you actually read through the article, right, I do say that healthcare workers are heroes, even though I have problems with the hero narrative itself. I think they're heroes because of the line of work that they've chosen, which is to help sick people. And first responders, firemen, police, right? They have all chosen to do similar things. Um, I will say part of the journey to writing this piece was really noticing a disconnect between what my husband was feeling and what other healthcare workers were feeling, and what the media, the media narrative that was out there, which was about this heroicism. And so my husband has said publicly that he feels like a lamb being sent to slaughter. Right? He feels scared. A lot of other healthcare workers are angry, they're outraged, they've walked off the job, right, as you just showed in that last article. And there was just this really big disconnect, between what I was hearing in the media and really what people on the front line seemed to be feeling. And so that's what led me to, I would say, to write the piece.
Yeah, I mean, and let me see if I can pull up one of the quotes from, just what you're talking about here. And this is what you had said in the article. Here it is. It says the prevailing media narrative surrounding healthcare workers has been that of heroism, of individuals sacrificing themselves at all costs for the good of others. The more dangerous the working conditions, the less PPE available, the more liberally the word hero is slathered on. But medical workers are not self-identifying as heroes. Many, like my husband, feel like lambs being sent to slaughter. Their attempts to protect themselves or speak out about their conditions have been met with retaliation from hospitals. And I thought what was interesting is that you were saying that I mean, people certainly wouldn't want the hero negative narrative or the that word to make people feel like they can't also have both positions, right? To say what you're doing is heroic, and maybe not understanding that one is getting in the way of the other.
Yeah, but I think when you have this hero narrative, right, it sort of prevents the other narrative from coming out, that of the healthcare worker as victim, right, of the failings of federal and state government, of hospitals to provide sufficient PPE, and so when you have this hero narrative, right, you have in mind this altruistic, do-gooder physician or other healthcare worker willing to risk everything at all costs. And it may be, taboo to say this, but I don't think that's always the case, right? I think each person and each family has a personal risk limit that they'll come to, where if there's not adequate protection, there's going to be a time at which healthcare workers say, no, I can't take this risk for myself, and I can't take it for my family.
Yeah, and you do mention that as well, in the article saying, you know, here's one quote saying from a healthcare worker on a Twitter account saying, if I walk away from this nightmare, I will be accused of patient abandonment. If I don't walk away, however, I am risking my health, my life. Does no one care? Is that, I mean, people get into healthcare work because they want to help people. I think that that's a fairly safe thing to say. Are you hearing from people who are saying, I don't want to go to work, but I'm scared what people will think of me, or even their fellow coworkers who are going to work?
It's really interesting because I think even amongst physicians, it's taboo to. So even our physician friends haven't necessarily shared that viewpoint, and only actually after the article came out did we start hearing from our friends that they've really shared similar feelings. But I also heard from a lot of people who I didn't know, um, who shared that that they did not feel protected by their hospitals, that they felt like they were being made to work in conditions that really were not acceptable and were not adequate. And they were wondering at what point, is it worth losing their job, in favor of protecting their own health and their family's health.
Right, because as with your husband, he is saving lives, but he also has some lives at home that he does not want to put at risk, does not want to lose. And that is I mean, it's heartbreaking in terms of just the position that people are in. Here's what I also, just one last little clip of your article that I wanted to pull up, because it is, and this is, from April 10th, so we just want to put it in the time frame of when these numbers were coming through. But you know you talked about healthcare workers are victims as well. In Italy, you have 94 doctors and 26 nurses at the time of the publication, 12,000 affected though. And so across Europe, and if you look, you know at a lot of cases, or the doctor in China who had tried to warn the community and died in February as well, the hero as well as the victim is certainly something that we also have to I think understand.
Yeah. And I think we're going to see, right? So those numbers were from Europe, and we're already starting to see, and we're going to increasingly see similar numbers coming out of the United States.
So what kind of feedback have you gotten since that op-ed? You touched on it a little bit, but in terms of who have you heard from? Have you heard from the people, the rest of us who are saying, oh, I didn't think about that when we said thank you to our heroes and our healthcare workers who are heroes? Or did you hear from the workers themselves saying, thank you for saying something that I feel like I can't say? Or did you get pushback from people saying that's, you're missing the point when we're calling them heroes?
Well, I've heard from all three. So I got all kinds of feedback. I will say that most of the feedback has been, and the people who've really shared the article have been people who've felt like this has expressed something that they've either been too scared to express or haven't been able to articulate in that way. And I've heard a lot from families and spouses of healthcare workers, and of people who are having the same conversations at home. Because again, this, when you have the hero narrative, it's really taboo to say, well, at what point am I not going to go into work, or at what point should I stop? So I heard a lot of uh, really disappointing stories. For example, there was one woman who wrote to me whose husband is a medical interpreter, which is something that can be done remotely, but he's still
Hmm.
being made to go into work, even though he's at high risk and she's at high risk as well. And honestly, it was really tough hearing all stories like that from other people as well, where in those cases the hospital really should be saying, look, you're at risk. You can do your job remotely, do it at home,
Do you
and that's
think,
not what's
yeah,
happening.
do you think we're at unprecedented times in the fact that, I mean, up until this moment, has your husband ever come home, or have you heard more complaints from friends who are healthcare professionals about not having proper equipment? I mean, when I do stories in hospitals, they load it up. It's never kind of been an issue of, oh, we don't have enough of this, you can't use that. I mean, that's where we're on, you know, very new territory, for a lot of people who have always had what they needed to do what they needed to do.
We've heard directly from many of our close physician friends that they do not have enough protective equipment. Even just 2 days ago, I had a friend who posted on Facebook that where she works, they ran out of gowns, and she was asking if people had any sewing patterns for garbage bags or for ponchos. So
Right,
this
but
has not gone away. Yeah.
yeah, but in your medical ethics, what you studied in the past, of all the things that have kind of come up into the space of what do we have to consider in these life and death situations, I would think it was more in the realms of, consent and DNRs, and when you decide make decisions, ha- in
And
history.
rationing. Yeah.
Yeah, in history, has it ever been about, just not having enough of this on this level?
I don't know the history of protective gear in
Yeah.
previous pandemics. So I don't know if I could completely answer that question. But I guess the first example that you would look to is um, the 1918 flu
Hmm.
pandemic. Um, but I don't know the
But and
history.
I don't know how much we knew even back then of, of what was necessary. I mean, I think now we know what would make us the most safe. If we could pick, if they could pick protective equipment, they would pick it and they would go, to the extreme. So
Mhm.
where does this conversation go next? I mean, as we look forward to, I mean, the supply chain continues to be an issue. The protective equipment for not just doctors and the healthcare workers, but the nursing home staff members, and for really everyone as they kind of try to go back into the world. Where do you think this conversation takes us?
Well, in my mind, the most disturbing thing, and I think the first thing that needs to happen, is hospitals need to, stop muzzling their doctors and stop retaliating against those who want to speak out about their conditions, because it's really those who speak out about their conditions and draw attention to it that I think will really spur change. And still, even today, it's on anonymous Twitter accounts. There's the one I linked to there, where people are having to speak out through, under the cloak of anonymity. They're too afraid to even come forward, and they should be allowed to speak out. They should be allowed to talk about their condition. So I think that's really the first step in my mind. And I know hospitals are doing a lot. Many of them weren't prepared, but they're doing a lot to try and source the equipment. We need to continue doing that, and we really need to do that fast, because our healthcare workers are our first line of defense
Yeah.
against this. And
And we are so grateful for what they do, and they need to go into that battle properly equipped. So in terms of then the term of how you recognize what they are doing and the enormous risk and sacrifice that they're doing going to work every day, challenge with that. I mean, I think you can be heroic in when you speak up. Whether or not you choose to do that is another thing. But I think that distinction between knowing that, police officers and firefighters know they're going to run into burning buildings. Firefighters, police officers know that, there's a lot of risk. They're carrying weapons, and, military, of course, which is where that hero term generally, can reside. What should we be calling our healthcare workers in order to show how much they are appreciated, and how much we recognize what they're doing?
I don't know if there's a specific term that we should be using, but I think, focusing at least equal attention in the media reports on their conditions, on sharing their stories of not having enough protective gear. I think that should get as much equal space as as the hero narrative, really
Yeah,
really shining a light on the conditions that they're working on. And it's people have started to do that, but it's not enough. Again, a lot of people are afraid to speak out.
is it not so much about not having the conversation, but adding to the conversation maybe, and making sure that we don't forget about mentioning people like your husband and the risks they face as opposed to the sacrifices they make.
Absolutely.
Yeah,
Like,
I think.
yeah.
Well, to your husband, thank you. To you as well, thank you for bringing light to such an important subject, and to your little one and your amazing family. I love the family pictures because it reminds us all, you know, of that we are not alone. We have these spaces that we are trying to protect for everyone, and your little one is due when?
September.
September. I am hoping the world, when your little one comes into, is a safer place than the than the one we are in now, and that you can enjoy that space. It
Thank
feels
you.
like a very long road that we are traveling on, but hopefully we will all make it to the end together.
Yeah.
All
Thank
right.
you.
Anna Wexler, who is a professor of medical ethics and health policy at Penn. Thanks so much for joining us. We appreciate the chat.
Thanks, Claudine, for having me.